Hi, Gelota. Sorry. Hi, Dr. Gelota. It's Deja. And today for my presentation, I'm doing the pathological disease gout. It is a form of arthritis. And the reason why I chose this as like my disease was because my stepdad actually has gout. And for as long as I've known him, he's always had flare-ups like randomly. So I thought it would be a good thing to research so that way I know what he goes through day to day or when he is experiencing his gout attacks, what they're called. So yeah, I liked doing all this research because it helped me understand more about him and about like his medical stuff going on. And I found out a couple of medications that he takes and why he takes them, what they're for, and why he eats the way he does because he did have to change his diet. Sometimes when he has flare-ups, or he can let loose a little bit when he's had like a good span of time where he hasn't had a flare-up. So I just thought it would be really cool to do this, and I'm probably going to end up sending this to him after I'm finished also. So I'm going to be talking about gout, and I have these two photos right here where it shows the buildup of uric acid crystals in the big toe joint right here. And it can, oops, sorry. It can also build up in just any of the joints in the extremities. So it could be in the ankle, the big toe, the fingers, elbows. So it can go in any joint. And I have an x-ray right here of someone's inflamed gout toe, and it can only be diagnosed when someone is experiencing a gout flare up. So if they're not experiencing it actively, there's not going to be any signs of gout when they do any tests. So our agenda for today is doing the introduction. We're going to talk about the signs and symptoms, the causes of gout, the stages of gout, the diagnosis, treatment and management, the epidemiology, history of gout, celebrities who have it, and a summary and my references that I used for all the information that I found on gout. And I have another x-ray right here, and this is of somebody's hand, and they have it in a lot of their joints. And you could see the soft tissue around it. It's actually very swollen compared to the other sides, like up here. And it's really wide. And there's a little bit of, it looks foggy or opaque where it should be more clear. So these are ways that they diagnose gout under with an x-ray. So introduction, gout, which is a form of inflammatory arthritis, occurs when urate crystals gather in the joints or joint of the extremities, most commonly in the big toe. Uric acid is produced in the body when it breaks down purines, and purines are naturally in our bodies already, but they can also be found in certain foods. So when you eat them, it could add up more uric acid levels, and you'll be more at risk of developing gout. So usually the uric acid found in the blood dissipates and is excreted out the body through the urine. Patients with gout can produce excess amounts of uric acid, which causes buildup. When this happens, sharp needle-like crystals of urate crystals, sharp needle-like shards of urate crystals start to form in the joints and accumulate. So it starts creating inflammation, and it usually happens in the joint itself or in the tissue surrounding it. And I actually have a picture of uric acid right here in chemistry. So signs and symptoms include intense joint pain, most commonly in the big toe, but can occur in any of the joints of the extremities. Lingering discomfort, so after a gout attack or after an inflamed joint has gone down, a couple days or even weeks later, there could still be like radiating pain or just like it says, lingering pain. It just won't go away, but it's not as extreme as when they were experiencing the actual gout flare up. And when they try to use their joints, they also have limited motion because the attacks are so painful. Movements of the joint is not really worth it to keep it, to try and move it. So they'd rather just leave it, don't touch it at all. And it just hurts a lot. And I've seen my stepdad experiencing that too, because we've like gone places and we try and walk around and we have to leave early because it hurts so much that he can't walk on it or he's limping when he's perfectly healthy. It's just that his big toe hurts so bad. Or one time it was in his knee and he was like bound to the couch and the bed for a couple of days. And I think that's the worst I've ever seen it, but I could tell it's extremely painful. Another sign is inflammation and redness. The inflamed joint will become very swollen, red, hot, and painful to the touch. And I even read on some of the articles that even the weight of a bed sheet on top of the inflamed joint can cause extreme pain. And I found this really good picture. It's pretty interesting. These are what uric acid crystals or urate crystals look like under a microscope. So I think they found this by they will inject or they will put a needle in the inflamed joint and pull out the surrounding fluid and then put it under a microscope. And this is actually what they see, the actual crystals. And this is why it's so painful for patients to try and move their joint or be productive at all, because they're just poking and it's very uncomfortable. So what are the causes of gout? Gout is caused by the buildup of uric acid, also known as hyperuricemia. Uric acid is mainly produced when the body breaks down purines. The purines you have in your body, and the more you intake by the food that you eat, the higher the possibility you have of getting flare-ups. Having higher uric acid levels in your body over a period of time can start to develop gout. A few elements that can increase the ability to develop gout are your age. Gout is mostly common in men, and signs and symptoms usually show around ages 30 to 50. And for women experiencing symptoms, it usually shows up after menopause because our uric acid levels are usually a lot lower compared to men. But after menopause, women start to produce more for whatever reason. And also, oops, sorry. So for gender too, so age, that's ages 30 to 50, and it's mostly common in men. And the diet is also very important as to why people get it, because eating more foods such as like shellfish or red meat contains a lot of purines, and the more purines your body has in your body, it has to be broken down, and the more uric acid is produced because of that. So consuming drinks with fructose and drinking beer can raise your levels also. And if you're overweight, you have a hard time excreting uric acid through the urine, so it'll cause buildup too. And pre-existing medical conditions such as high blood pressure, diabetes, heart and kidney disease increase the risk of gout also. So certain medications can also induce having gout. So anti-rejection drugs, when someone has had a organ transplant and they're on those medications, or high blood pressure, hypertension medications can also raise the developmental potential for gout, and also having family history, because gout is genetic. So the stages of gout progression. Stage 1, high uric acid levels. So uric acid is building up in the body and starting to form crystals around the joints. So stage 2 is acute gout, where symptoms start to occur, causing a painful gout attack. And stage 3 is intercritical gout, periods of remission between gout attacks. So they're not constant, but they come back a lot. They'll go away and come back, go away and come back, depending on your levels. And stage 4 is chronic gout, where the gout pain is very frequent, and tophi actually form in the joints. And tophi is just like it's almost like scarring. It just starts to produce like lumps wherever it happens a lot, and they just don't go away. And they could be pretty painful, because if you have like something protruding on your elbow or your knee, you can't lean on the joint. You can't use it like how you're supposed to, because it has this big bump or maybe a bunch of tiny bumps on it. And then stage 5 would be like treatments, receive medications for gout flare-ups or pain management and for prevention. So how is gout diagnosed? A doctor who specializes in gout or arthritis, which is known as a rheumatologist, will assess the patient's symptoms. The doctor will also give the patient a physical examination, probably looking for those tophi on the joints. The patient will receive x-rays on the inflamed joints, and again, they will only show if the patient is actively experiencing a flare-up. Ultrasounds also help find the crystals and the tophi in the joints, and lab tests specifically for uric acid levels in the blood and also uric acid crystals. Like I said earlier, they'll put a needle in the joint that's inflamed, get a sample of the fluid that's in the joint and put it under a microscope and find those crystals again. And I have it in red right here. Tests can only be performed while the patient is experiencing a flare-up. That's the only time they could diagnose it. So gout treatment and management. There are two forms of gout medications. The first one is to prevent gout complications. So these medications include alloprem, loperamide, and Uloric, which my stepdad actually told me he takes. I asked him what medications he takes, and he is on Uloric to not have flare-ups. And it helps stop producing uric acid. So these help by limiting the amount of uric acid production. Propilen helps the kidneys remove uric acid through urine, consequently lowering uric acid levels because it's being excreted out through the body and it doesn't have the ability to build up. The second medication is to help reduce inflammation, lower the pain caused by gout attacks, and prevent future ones. So these include non-steroidal anti-inflammatory drugs such as Aleve or Advil, Celebrex. So just pain relieving medication, and corticosteroids. So these help with inflammation also and pain. And it can be injected into the joint or pill form. And the prescribed medication for the patient is usually based on their severity and prevalence of their gout attacks. So I have this picture right here. Move myself out of the way. So gout symptoms, never ignore. If you ignore these symptoms, they could lead to other medical issues, which nobody wants. So if the pain doesn't get any better, you have to see a doctor, especially if you're on medication, because you might need different dosage or a different type of medication to make sure that it's working. You could get pain in your knees, your ankles, your wrists, your elbows, and also if your uric acid levels are very high, they can start to form kidney stones because it's not being excreted out of the kidneys or out of the urinary tract or urinary system. So just like normal kidney stones, like salts and minerals build up, so does the uric acid, and it starts to form actual crystals, little tiny rocks, and they have to be peed out naturally or surgically removed if they get that big. So, and the strange lumps around your joints are tophi, which we talked about earlier, and pain in the big toe, which is the most common. So epidemiology of gout. Prevalence of gout cases are starting to become more common all around the world. Other countries' management of the disorder is not as effective compared to the US. Patients are not consistent with their treatment, and neither are the physicians. I don't know if they don't realize how serious it is or if they just don't have the same research that we do, because it seems like it's most cases are like in the US or other places where we have a lot of access to food, but now it just seems like it's more common everywhere. And also America is known for our obesity, and obesity is a prevalent cause of gout, and many people do not know that it's even a risk. So I found this picture too, and this is called the spiral of gout. So first, when the crystals form, the white blood cells attack the crystals to try and get rid of them, and the crystals pop the white blood cells, and then the white blood cells release proteins, and then the proteins calling for more white blood cells, and it causes more inflammation. So the neutrophils are probably trying to help and do their job, but they're just dying, so they keep calling more and more and more, and it gets more inflamed. That's why the symptoms are like inflammation, heat, and pain and redness, because it's just inflamed. It's just making it worse. And then the proteins lower the pH, making it possible for more crystals to form. So it's just making it worse. Your body's trying to attack these crystals forming, and then the crystals are attacking back, and it's causing, reinforcements, and it's just the gout circle of life. So gout history. Gout is one of the oldest known forms of arthritis. It was discovered in the 19th century. We found out that the cause was from the inability to metabolize uric acid. And gout belongs under the umbrella of crystalline arthropathies, which is a group of joint disorders that deposit crystals in joints and the surrounding tissues. And it's one of the most treatable forms of arthritis today, which is a good thing, but it's still very painful. So who discovered gout? Gout was discovered by the Egyptians in 2600 BC and was then called the disease of the kings because they drank a lot, they had lots of access to foods, and they didn't know it was actually raising their uric acid levels. And acute gout was discovered around 4000 BC by Hippocrates, and he called it the unwalkable disease, of course, because you have inflammation like in your knees and your big toe most of the time. So people have a hard time walking around, or it's not worth it to, and they just don't want to. So I have another picture right here, and here's more places. So it can develop in the wrist, in the elbow, in the fingers, the big toe, most common, the ankle or the foot, and the knee. So celebrities who are diagnosed with gout. So Jared Leto, who is an actor, actually induced gout on himself by accident. So he was diagnosed with gout after intentionally gaining 60 pounds to be a better part or a better fit for a movie role. And I saw a article, and he had a quote, and he said, "I didn't realize what I was doing." I think he actually developed hypertension too, just for his job, which, if you ask me, it's not really worth it. But and also Kim Jong-un, which makes sense to me. It's kind of like the king's disease, where he has all this access to food and drinking and alcohol and all this stuff, and it makes him gain weight too. So that doesn't help. He's not being healthy, and he's just inducing gout on himself. And there's been some times where he doesn't make appearances because he can't walk, or because it's painful, or he's been seen holding a cane to help him walk too. But since gout is associated with like a bad thing, it's a disease, it isn't really out there, or he tries not to let it go out there, but we still know. And Jim Belushi, he also has gout, but it's hereditary for him, and a lot of his family members have it. So I think he's made a foundation with his family too, just to bring awareness to gout, because it is a lot more common than most people think. And my stepdad, for privacy reasons, I didn't put a picture of him on here, but so far he is the only one in our family that has it. But his mother has arthritis, like kind of bad in her hands. I feel like there might be a connection there because gout is an inflammatory arthritis. So, I mean, I feel like there might be a reasoning to why he developed that. And for a summary, I have this video. It's 2 minutes, and there's this doctor who explains pretty much everything that I went over in under 2 minutes.
90% of the time, gout shows up for 4 to 12 hours at 10 out of 10 pain when you wake up in the morning. It is caused by a chemical called uric acid. This is a DNA breakdown product for people who eat too much red meat, too much seafood, and too much curated meats. It's also likely if you drink alcohol, not enough water, and you're a male, ages 30 to 50, although it can happen to women, and when you wake up in the morning, it's the worst pain of your life. Gout can be dangerous because not only does it cause pain for the first day, but if it happens 3 times in a year, that means you're likely to get buildup in your joints. You probably should be on a medication called allopurinol to prevent it from being created in your body, or potentially in medications to help you pee out that chemical quicker. Uric acid is a breakdown. Diet will control it from building up in your system. So studies show stop eating the meats. So curated meat, red meat, seafood, lose some weight. The more weight you lose, the less alcohol you drink, the less carbonated beverages you drink, the better you will do. The more you hydrate, the better you will do. Anecdotal studies and early research show coffee is great for it. Although if you don't drink it, don't start now. Cherries can be good for it. Vitamin C can be good for it. Drinking a ton of water can be good for it. Low stress can be good for it. These are not proven things, but they work great. The number one treatments are find yourself a podiatrist or a great primary care doctor who can send you anti-inflammatories such as indomethacin or Celebrex, or you can even use over-the-counter ones when it first hits. I prefer steroids and a medication called colchicine. These work great.
Okay. So that doctor had more information that I didn't talk about too, but I do like what he said. He hit points that I didn't, and I had fun doing this project. It's helped me learn a lot more about gout and what my stepdad has to go through, or even when I was younger, not realizing why do we have to leave, or why is he walking like that? He was fine the other day. Or we had a vacation one time, and both of my little brothers were sick at the same time, and they were vomiting and using the bathroom. And this was the first and only time he ever got gout in his knee. And it was so bad that like I couldn't tap him on the shoulder because any movement would move his knee, and it was just so painful. So when we had taken my brothers to bring them to throw up in the bathroom, he would, by the time we were finishing wrapping up, my stepdad would barely finish limping into the room, and my mom and I were just like, just go ahead and sit down. You don't have to help. We get it. We understand. So, I've never made fun of him for it. I hope nobody else does, but it just I feel a lot better now that I know what he goes through, and it was fun doing this project. So I have my references here with their links, and I use the Arthritis Foundation, the CDC, the Center for Disease Control and Prevention, Cleveland Clinic, Johns Hopkins Arthritis Center, and Mayo Clinic. So thank you for your time, and have a good day.